Welcome to This Week Health. My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, a set of channels dedicated to keeping health IT staff current and engaged. Today we have an interview in action from the 2023 spring conferences, Vive in Nashville and HIMSS in Chicago. Special thanks to our partners, CDW, Rubrik, Sectra, and Trellix for choosing to invest in our mission to develop the next generation of health leaders. You can check them out on our website, thisweekhealth.com. Now, on to this interview. All right, here we are, HIMSS 2023 in Chicago, and I'm here with Tim Goodwin, Certify Health, and Carmody, UPMC. You don't have a title.
It's Senior Vice President and CTO.
CTO. And your title?
I'm the Vice President of Partnerships and Strategy.
This title sounds more important.
Yeah, I was just going to say that you beat me, Bill.
Wow. So Tim, what's Certify Health?
So Certify Health, we're a patient engagement and digital authentication platform. So we authenticate the patients when they step into the health system, but also can enable a digital front door. So you can check in without paper clipboards, but also layer on the authentication so that the health systems know who the patients are before they enter into the health system and then when they enter in person.
It's also this big, I'm thinking the duplicate problem of thinking the things I want to do before they're actually in EHR.
Absolutely.
How does this play out?
So it's played out very well for us at UPMC. So we've used Certify for, 6, 7, 8 years. It's been a while, but it's really streamlined that welcoming access process. So you're coming into one of our facilities, whether it's a hospital or a physician practice, and checking in. If you check in and they whisk you back to your exam room instead of having to sit in a waiting room and then go up to the front desk, fill out a clipboard. So it's really helped streamline that process and make things simpler for us. The other thing that Certify does that we've used it for is a little thing called COVID and the vaccine administration. We actually leverage the platform to do the administration. So all the scheduling for about 1 million vaccines across all of our service areas at UPMC in Pennsylvania, into New York and Western Maryland. And then more recently around access management, just the facilities. So whether it's vendors, visitors, whomever coming into our facilities, to check credentials and again, provide us with who's coming into our facilities and what they're doing there. So it's been extremely helpful from an access, from an authentication perspective as well, which is the last thing they're doing, helping us authenticate our users. Again, it's all about efficiency and effectiveness for our clinicians. They have so much stuff going on. If we can remove those barriers, those burdens from them, that's what we certify playing that role. So it's not just about patient access; it's about everyone's access to UPMC.
So what's the differentiator for Certify? When I hear some of those things, what's the differential?
So we almost become a vendor replacement because we do so many things. So you have one point of contact for all of the different things that Chris spoke about. We replace vendors on the patient-facing side, the clinician-facing side, their vendor stuff. So, if Chris needs a change or an upgrade, it's one call versus let me find the 10 vendors across the ecosystem. So it helps streamline a lot of the efficiencies in the enterprise.
So we were looking for platform.
Yes.
That's the key word. If it's a platform, and we've leveraged their platform, like I said, but just from the COVID piece, it sort of wasn't really an area that any of us were focusing on, but because they had the platform in place, we were able to quickly move and be able to again, change with all the different requirements as the vaccines became available.
Let's unwrap that use case. Because COVID came upon us pretty quickly. And now you're sitting there going, all right, what do we need to do? Take me through that process of you're sitting in a room, people are going, hey, we need to do this and this and this very rapidly. And you're sitting there going, all right, well, we have Certify, we have a portal, we have some other client-facing tools. How did you do all that?
Again, just surveying our landscape of technologists at the time. You had some bigger vendors, obviously they're well represented here today, but just who could we work with that would actually listen to us, absorb and process our requirements about what we wanted to do very quickly. I mean, we're talking, we had conversations, it was under 24 hours that Certify was developing. We had a prototype, we had a proof of concept system in about 2 weeks. So it was that quick. And then again, the requirements changed about what age group could actually register, schedule for a vaccine. And we UPMC took a different approach too, because we based it upon the inventory of vaccines we received. We weren't just scheduling people and then telling them, no, don't tell me we don't have a vaccine for you. We wanted to make sure we have a vaccine for you, so it tied it to inventories. So that whole process just became so much more streamlined working with Certify than any other, like, every vendor was trying to create something on the fly. So we did it efficiently, effectively, and it really made a difference in our communities.
A lot of conversations with health systems right now is around efficiency, it's around Windows experience, and making it better. Talk to me a little bit about how Certify makes that experience better for the clinician.
So I think it's all about giving people time back in the day. A lot of the platform, parts of our platform solves that is how do you give the staff or time back in their day to do the jobs they're actually set out to do. On the clinician side is you don't have to enter in all the paperwork. You don't have to start asking for a driver's license and trying to authenticate, getting stuff to the scanner, and really turn the front desk more into a customer service type of role. When people come in, it's greeting them by their first name, they're authenticating who they are. So it adds on the layer of the patient experience that you kind of can't calculate in an ROI, so it's that soft ROI, patient experience, engagement that everyone talks about. But the biggest thing is time back in their day to do the jobs that actually enhance and make their efficiencies.
Alex's lemonade stand was started by my daughter Alex in her front yard. By the time she was 4, she knew there was more that could be done. And she told us she was going to have a lemonade stand, and she wanted to give the money to her doctor so they could help kids like her. It was cute, right? She's going to cure cancer with a lemonade stand. Like, only a 4-year-old would think that. But from day one, it just exceeded anything we could have imagined because people responded so generously to her.
We are working to give back and are excited to partner with Alex's Lemonade Stand this year. Having a child with cancer is one of the most painful and difficult situations a family can face. At Alex's Lemonade Stand Foundation, they understand the personal side of the diagnosis, the resources needed, and the impact that funded research can have for better treatments and more cures. You can get more information about them at alexslemonade.org. We are asking you to join us. You can hit our website. There's a banner at the top, and it says Alex's Lemonade Stand there. You can click on that and give money directly to the lemonade stand itself. Now, back to the show.
From an experience standpoint, if you're able to list them through that process, I would think you just end up with less angsty patients. We're like, we got I was sitting out there for 20 minutes, now I'm sitting in this room for 20 minutes. It's like,
Absolutely.
what's this?
Definitely helps in streamline. So there are quantifiable savings, and we've seen that, especially when we first adopted Certified, doing the fingerprint reading to check people in. It took a little bit of time with that adoption, and everyone's sort of resisted the change, especially when you're so used to going into a front desk and checking in. But that really helps us do it. But your point about like the clinical side, like the actual doctors and nurses, that again we partner with Certified to help streamline and give them more time back in the day. We're also doing it very securely, and that's also very important. Especially my job as a CTO, responsible for all cybersecurity. But we want to make sure that the work that they're doing is secure and they're properly authorized to do what they're doing, getting into whatever system they are, and leveraging the Certify platform. We're trying to look for ways to take out all the friction of someone just coming in to see a doctor or PA, whatever they're coming in to be seen. We want to make that as simple as possible for them. They're stressed out. They're worried about what's wrong with them. Again, so we can make that process easier and remove that, get them right back to the exam room and make it happen fast. I think everyone wins.
Where is the conversation best to start for you at Certify? I mean, is it CTO? Is it CFO? Is it someone?
It depends really on the organization. Most of the health systems we work with, it's the CIO, CTO, enterprise now, because they kind of have the overarching tech.
Is there a security?
There is. So usually the way it works is the CIO, CTO, people get in, and their next call is to the CISO, right? A huge security assessment team. And I think that the one piece with UPMC that we learn a lot is they don't have to go out and audit all of these new vendors and companies. We're already there. It's already been through system. It's secure. We handle so many biometric and patient records data. We have to adhere to the highest compliances, high trust, and all of our algorithms are just compliant. So it's really an ease for a lot of these C-levels because they don't have to do much once it's in the system.
I would add two things. Like in our example, our chief quality officer is very much drives the workflows, right? We don't know the workflows as well as they do. And our CMIO was also very instrumental in helping with the adoption piece. And again, it's a change management.
Do you have to put a lot of devices out?
We did. We
Talk about biometrics.
Yep, all the biometric readers. Yeah, basically fingerprint readers put out there. But again, very very small investment, and it translated to a lot of savings. So again, the front desk staff, they went from sitting behind the desk, checking people in, crossing their name off, blocking it out on a paper sheet, to welcoming that person, helping whisk them through, answering any questions if it was their first time doing that. Again, we train them, make sure that they have that support, and then getting them back into the exam.
Well, Tim,
Bill, thanks so much.
Bill, thank you.
Another great interview. I want to thank everybody who spent time with us at the conference. I love hearing from people on the front lines, and it's phenomenal that they've taken the time to share their wisdom and experience with the community. It is greatly appreciated. We want to thank our partners, CDW, Rubrik, Sectra, and Trellix, who invest in our mission to develop the next generation of health leaders. Thanks for listening. That's all for now.